New tonight at 11, the effort to find a cure for COVID-19 is now going mobile. Right now, researchers are collecting blood samples from people who had or have the virus right now to see if the solution could be inside our own bodies. Our Mary Mills discovered one company willing to travel anywhere in the country to find answers.
Researchers around the world racing to find a cure for COVID-19. To do so, they need help from those now ill from the virus or in recovery.
In the case of COVID-19, we have been fielding hundreds of requests from the research community asking for COVID-19 positive samples.
Lori Ball is with Biological Specialty Company. It collects donor blood and other specimens for scientists. And right now, many are focused on stopping COVID-19.
We will go to any zip code anywhere in the country to help collect these samples.
What's key here? Instead of going to, say, a hospital, BSC now has mobile units, so the blood draw can be done at the donor's home, making it easier and quicker. Ball says getting as many samples as possible is critical for faster and better diagnostics.
So figuring out who has the disease. The second reason is to understand antibodies. So those people who are successfully fighting the COVID-19 virus, what's happening in their body? How can we understand what is happening? And then the third area is actually vaccine research, figuring out how we can combat this illness effectively.
She says donors will remain anonymous and receive some compensation for their time, but says that's not a key motivator.
This is a result of many inquiries from COVID-19 positive patients saying, I want to help. Surely my samples can contribute to research. And so this is our attempt to match those willing participants with the research community that is on the race for a cure and certainly a treatment.
Now, if you want the details on how to help, we've got the information posted tonight on WTHR.com/coronavirus. With 30 new deaths and nearly 6,000 Hoosiers now testing positive for the coronavirus, we're getting a new look tonight at when the peak of COVID-19 could finally hit our state. The Institute for Health Metrics and Evaluations looked at the current trends and social distancing measures, and here's what they've determined. Indiana, according to them, is likely to see its peak of COVID-19 cases on April 16th. That's 1 week from tomorrow. The Institute predicts the curve will last until the end of June. Governor Holcomb warned today Indiana's fight against the coronavirus is far from over.
We're in the first quarter, just in the first quarter of this game. We got to be just as intense about our practices today and tomorrow and next week, and it's going to make a difference.
Now, a lot of these projections probably seem frightening to you, so I want to focus tonight on the facts to put things in perspective. There are a few small silver linings tonight. Indiana's hospitals are not expected to see a bed shortage. The total number of Americans projected to die from the coronavirus is much lower than expected. Original predictions, you probably remember, were between 100,000 and 240,000, but the Institute lowered that number today to about 60,000. Now, that's still a lot of people, certainly lots of families who would lose loved ones. The best way to get that number even lower is to continue social distancing. Our nation's top doctors continue to tell us that's what's making a difference right now, even though it takes weeks to see the real benefit. So keep following public health guidelines. Continue staying home, because even if it doesn't feel like it, you are making a difference, and you're helping to save lives. But we've got a new update to our 13 Investigates report tonight on COVID-19 outbreaks at Indiana nursing homes. The state health commissioner issued an order today with new reporting requirements for long-term care facilities. Now they have to report all positive test results and coronavirus-related deaths to the state health department within 24 hours. So far, health teams have visited about 200 of our state's 735 nursing homes. And of the 600 people tested, about 190 of them were diagnosed with COVID-19.